Good afternoon, everyone. Thank you for being here today. My name is Sherry Armstrong. I'm the President and CEO of the Community Foundation, and I want to welcome you to our program. As we begin the program, I'd also like to take this opportunity to thank our speakers, Jim, Monica, Reggie, and Amy and James for giving us their time. We're really excited about this learning event, and we hope that you are too. It has been and continues to be an extraordinary time of change. Everyone in service to our communities has had to step up and lean into addressing a public health crisis like we have not seen before. It's in that context that we bring these change makers together for us to listen and learn about how they have and will continue to respond to help ensure our recovery and resiliency in the region. At the Community Foundation, we are committed to making Richmond a better place, the region a better place for all of our residents. We take a collective action approach with nonprofits, businesses, and local government to ensure the greatest impact. Our strategy is to invest our time and dollars into work that creates equality of opportunity and economic mobility. We take a cradle-to-career approach with emphasis on supports, including early childhood development and education, workforce development, and affordable housing. The local government leaders you will hear from today play a critical role in helping to support this work, and we're extremely grateful to you for your efforts and partnership. Thank you again for being with us today, and at this time, I'd like to turn the program over to Scott Blackwell, our Chief Community Engagement Officer. Thanks.
Thank you, Sherry, and again, welcome to everyone. Thank you for spending some of your afternoon with us. I'd like to tell you a little bit about our agenda, and then we will get started immediately with the panel. So our agenda, what we're going to do is we're going to start with each of the community leaders introducing themselves, and during their introduction, we will pivot between a couple of slides that give you some insight into the demographics and some of the challenges within their community. Our good friend Amy Strite is going to moderate this panel. I'm going to use this moment to introduce Amy. Amy was the new CEO, or became the new CEO of Virginia's Voices for Virginia's Children in this past October. Amy leads work that focuses on system-level change with an emphasis on racial equity and trauma-informed care. Amy has many, many skills, but the one that jumps off the page to many of us here at the Community Foundation is the commitment she has and has continually demonstrated in leading organizations that embrace the importance of social justice, diversity, equity, and inclusion. And then to give you some sense of her background, prior to her current role, she was the CEO of Family Lifeline for 13 years. She has also worked at SCAN, Sacred Heart Center, and the Richmond AIDS Ministry. And she serves now on the boards of Richmond Memorial Foundation and Smart Beginnings RDA. So we are very happy and very appreciative to have Amy and her incredible talents and experience in moderating this panel. One last thing before we get going, we will welcome your questions. We ask that you use the QA feature on your screen, which generally you can find at the bottom of your screen. You will be on mute, so we won't have audio capability for questions. But if you will type them in, we will get to them during the panel discussion or at the end when we've allotted a few minutes for Q&A. So again, thank you, and I'm going to turn this over to Amy with our great thanks.
Thank you, Scott. And I have to say, it is such a privilege to be with all of you here today, and I'm personally grateful for the opportunity. I am going to start by turning it over. We're going to hear from James first, and James is going to do an introduction, and we'll start with Chesterfield. You're going to notice we're going to go in alphabetical order according to region. So James, welcome, and I'll let you start.
Thank you, Amy. Thank you, Scott. It is a pleasure to be a part of this panel today. I'm James Worsley. I'm the Deputy County Administrator in Chesterfield County, and over the Human Services Division. And in the Human Services Division, we have several departments, and those 6 departments represent Citizens Information Resources, Community Corrections Services, drug courts, juvenile detention services, mental health support services, and social services as well. And I also get the great honor of serving on several boards, but just to name a few, the Health Center Commission, as well as Senior Connections, the Capital Area Agency on Aging, and Homeward as well. I've had the pleasure of working for Chesterfield County for the last 5 years. 4 of those years was as the Parks and Recreation Director. And last October, I had the pleasure to step into the role of Deputy County Administrator, which has been a great experience. Previously, I worked for Charlotte, North Carolina and Mecklenburg County as the homeless coordinator. And I always like to give that background because people always like to know, well, how did you get involved with human services? Well, I'm here to tell you folks, Parks and Recreation is human services at its core. I worked in Charlotte, North Carolina, put me in the land of working with individuals that were homeless and providing services for those individuals as a recreation therapist and building programs. I also had the opportunity to work as a treatment therapist in Davidson County in the mental health department as well. One of the things that I always like to share, and people generally like to wonder, why are you in the field of human services? And so my answer, my philosophy is very simple. If not me, then who? If I'm not stepping up to be an advocate or a voice for the voiceless, then how can I expect others to do so? I have a passion to give back and help others among our most vulnerable populations. And this really stems from my own family experiences with mental health, substance abuse, and yes, suicide as well. And other contributing factors such as I grew up on a farm in Eastern North Carolina, and I watched my grandparents take care of others their whole lives. And certainly a foundation in Christian principles lead that effort as well. So I will pause there and I'll let the next panelist introduce himself.
Good afternoon, everybody. This is Jim Taylor, Deputy County Administrator from Hanover County. And as you know, Hanover County is the home of Patrick Henry and the best tomatoes in the world. I've been with Hanover for 21 years. Prior to Hanover, I also worked at St. Joseph's Villa, Capital One, Central Fidelity Bank, and also Retreat Hospital. And I just want to give a shout out to the Community Foundation for hosting this event today. And also early on in the pandemic, as you may know, the Community Foundation stepped up to help our region. They raised over $1 million. And I'm just so appreciative of the grants that were made available to localities and our partners to, at that time, when we really needed it. And their process was just so easy. It was like a one-page application, why do you need the money and what are you going to do with it? In Hanover, we were able to take that grant and provide meal kits to our residents. And, Hanover County has much to be proud of. We have excellent schools, public safety, high quality of life, and a caring community. You may have seen that recently we ranked in the top 100 for healthiest communities in the country. And we scored high in terms of population health, equity, education, and economy. And I'm also proud when I hear that a family moves to Hanover for our special education supports. But while our poverty rate at around 5.3% is a little lower than others in the region, it still exists. And that's where our human services departments are so important. With a population of around 108,000 people, you might be surprised that we have over 10,000 customers at our Department of Social Services. Affordable housing and public transportation are issues in Hanover, although we have started recently our Hanover Dash program, specialized transportation for seniors and the disabled. We are fortunate to have so many grassroots partners in Hanover, such as our faith-based organizations, MSF, ACES, and WHEAT. And that is what makes Hanover County so special. And as you know, government can't do it alone. So thanks for the opportunity to be with you today. And I guess I'll pass it along to Monica.
Good afternoon, everyone. My name is Monica Smith Callahan. I serve as Deputy County Manager for Community Affairs here in Henrico. I started here in Henrico literally 2 days before the pandemic hit. I am just over a year into this role. And I will tell you, I came in as an outsider, born and raised in Henrico, having worked and partnered with Henrico in previous roles, but never worked for the localities directly. And coming in, I had such grand ideas and how I wanted to define this newly formed role as a deputy county manager. And of course, the pandemic hit and life happened. But I will say that this has been the most tremendous year and a half of my career. It's been challenging in so many ways and amazing in so many others. So prior to coming to Henrico, I did a small stint at the Department of Education, where I served as Assistant Superintendent for Policy, Equity, and Communications. Before that, I was with the Greater Richmond Chamber, where Chamber RVA, where I served with Workforce Lens over our future RVA programming. And before that, you guys may have remembered a little bike race we held in the region back in 2015. I served as community engagement for the Richmond 2015 organizing committee of the UCI Road World Championships. So I have been in this community for and working in this community for many years, working with our nonprofit partners, government entities, as well as education. So coming into this role, it felt like home. But of course, not banking on the fact that we were going to have a global health pandemic. As you can see from our slides in Henrico, we are very diverse, the most diverse in the region, with the numbers of folks from different backgrounds. So with varying diversity comes varying needs. Our human resources agencies, most of which don't fall in my portfolio. I do have libraries, I have workforce, I have the registrars, am liaison to schools and to health. And then of course our non-departmental, which is the nonprofits in the community that we all work with, as well as the faith community. But our human services proper, the way we are structured in Henrico, fall under our Deputy County Manager for Public Administration. But I work very closely with our mental health, our DSS, our recreation and parks, as James said, very much a human services focused organization. And we all collaborate and work very well together. My mantra is, I'm here to mobilize and motivate people to serve our communities. And that's what we're here for as local government, is to be collaborators, to be conveners, to do this work that we refer to as collective impact with fidelity. So that is how I see my role here in Henrico. Thank you.
Good afternoon, everyone. My name is Reggie Gordon. Thank you to our friends at the Community Foundation for this opportunity. And I'm so grateful to share this panel with, of course, Amy Strike, who I've known for years, Monica, Jim, and James. This is our peer group. So you'll find out during the course of this panel that we're not strangers at all to each other. And I have such respect for their skill and their commitment to the residents of their respective jurisdictions. So I have been in this role as the Deputy Chief Administrative Officer for Human Services, it's a long title, for the City of Richmond for 3 years. I've been at the city for 5. Before coming to the city, I'm from Richmond, grew up here, moved away for a while, lived in DC, but scurried back home because I wanted to be a part of my hometown's evolution and growth. So when I got back home, my first job back was with the United Way. And then I went to Homeward. After that, I went to Williamsburg Community House, actually back to the American Red Cross for Virginia. And then I came to the city 5 years ago to direct the Office of Community Wealth Building. So the role for the portfolio of human services includes various departments, all with an aim to make sure that we can have pathways to success for the residents of our community. Of course, poverty reduction and addressing inequities is front of mind for the mayor and the administration and council. And a lot of that work squarely falls within human services. We have the Department of Social Services, Department of Justice Services, Department of Parks and Rec and Community Facilities. We have the Office of Community Wealth Building, the Office of Immigrant and Refugee Engagement, Office of Aging and Disability Services, Office of Children and Families, and the new Office of Equity and Inclusion. And I have a dotted line relationship with quasi-governmental organizations, the Richmond Public Library, Richmond Behavioral Health Authority, and Richmond City Health District. All of us are serving the same people, and we definitely try to take a multi-generational approach to the needs we see with the hope of improving the quality of life for all the people in our community. So I, just like my colleagues, every day we have opportunities to help people move forward. Yes, there are challenges, but I think we're at an important point in our work in the human services field. So I'm happy to share those thoughts with my colleagues and you today. Thank you.
So I want to thank you for getting us started and sharing information that gives us a common foundation for our discussion. More importantly, I'm appreciative that you took the time to highlight really who we are as a region, because that matters, and that will allow us to have some focus throughout our time together. So as everybody knows, I'll be asking a series of questions. There'll be opportunity for the audience to ask questions at the end and throughout. So we're hopeful that this dialogue today will be conversational in nature. So there's no formality in who answers what question first. So if you all are okay, I'm going to go ahead and get started. So very first question, what did it mean to be a leader in 2020? And what adjustments did you have to make, if any?
Well, that's a loaded question. I don't mind kicking it off, since I was probably the first to speak, and give the other panelists a time to catch the breath. So, that's a great question. Being a leader in 2020, as we have to unpack it just a little bit, Andy. So I'm going to try to do that in my short time of giving you some thoughts that I have from Chesterfield County. One is that leading by example is certainly part of that. And being present is another issue that I want to bring forward, and be available and to be empathetic. We have to be innovative as well. And I think that the leaders here in Chesterfield County, and I'm sure it may be relevant to everywhere else, we have to reimagine the work environment in which we work in, and execution of services look differently. For example, curbside services at libraries, or telehealth, for example. I really had to trust my team more perhaps than you didn't really think about that before, because you saw them every day, but we didn't see each other every day. So trusting the team became very important. And I'd like to say that's a luxury of working with some phenomenal human service professionals here in Chesterfield, who I often refer to as my business partners as well, and communicate as much information that is available to the team in a timely manner. That's crucial, getting information from point A to point B. And then of course, I think it's also important as a leader from 2021, things that I found very valuable is understand that diversity and the engagement must be a priority and a permanent part of our work culture, not seasonal and not occasional experience, but permanent part of the work culture. And we have to be willing to stand up, even if it might not be the most popular thing to do, quite honestly. And then when you talk about the adjustments that we have to make specific to COVID, again, I mentioned about the reimagine the workforce for the work environment. Many were furloughed also, as you well know. Many were reassigned to duties that were much different than their regular jobs. For example, you may be working in one department and have to go to work in the registrar's office that stayed open, or something like that. Some moved to teleworking, and others moved to telehealth where appropriate, like social services and mental health. Some never closed. Some of our employees never closed. They may have a day to kind of reconvene how they're going to structure, but they had to deliver services regardless, like our courts, our residential services, mental health support services, our juvenile detention center, 24-hour facilities. And then taking and looking at flipping the pancake a little bit with the other issue that we had, racial unrest and social justice issues. In 2020, Chesterfield County developed a diversity and inclusion coordinator position led by Kimberly Connolly here, who is now our Assistant Director of Citizen Information Resources. We also put forth a diversity committee and a think tank. And then the last thing I'll note is we had also kicked off a series called Inclusion Starts With Us series with employees to discuss tough racial and social justice issues via Microsoft Teams, and that went over very well with our employees to be able to talk about those things as it relates to Joy Forward, all the way through some of the pivotal points that work in the work environment, and certainly looking forward to some of those issues a little bit later.
Thank you, James. Who'd like to go next?
I'll go next.
Oh, go ahead, Reggie.
Okay, all right. Well, you know, we had to go into crisis mode. And I have to say, all of us, I'm sure my colleagues, I know that for a fact, and just like James mentioned, it was not business as usual. And so we had to prioritize and figure out new ways to deliver services, because for us, we did not have the luxury to completely disengage, because we are essential and people were depending on us to not only keep, but probably enhance our level of service during the midst of a pandemic. Now, this is when a crisis occurs, and I think I knew this from my Red Cross days, but it was true during the pandemic. People, residents want to do the right thing. They want to help those who are vulnerable. The problem is, and that's why I'm glad we're doing this, a lot of people don't realize we do this every single day. You know, whether the sun is shining or it's raining, or whether there's times of prosperity or recession, we are always focusing on the needs of vulnerable people or just the quality of life in general. So I was concerned or worried when I saw some chatter about, let's get together to help the homeless. Let's get together to get food for people. It's like, no, we have people who are skilled and experts in that. And so I want to just acknowledge something. We created an expert cabinet at that point. These are people who have been doing this every single day. And I wanted to make sure that we got out ahead of that. And so that's when the cabinet started. And I would like to just acknowledge the people who were part of that process, from homeless services to with Kelly King Horn, to behavioral health with John Lindstrom at RVHA, community connections. We had Molly Reinhardt with The Friend, early childhood, Rich Schultz with Smart Beginnings, Richmond Public Schools, Sade Harris, Matthew Stanley, emergency financial assistance, Patrick Graham, and then ACTS with Billy Porch, Danny Avula with Richmond City Health District and Margot Webb there, Help One RVA, we had William Thornton and Jana Smith with the Y, Valerie Mitchell from the Office of Community Wealth Building, Carla Ramos from the Office of Immigrant and Refugee Engagement, older adults, the late Thelma Watson with Senior Connections, Public Safety, Richmond Police Department, The Giving Wall, Becky Crump, Damon Jiggets for Transportation, Vanessa Diamond with Hands-On and RV Engage, and Jerry O'Neill with Resources for Independent Living. The point being, those are the backbone organizations that work with all of us, all of my colleagues here. So I think during this pandemic, we've just recognized the need for us to draw closer together, to work on partnerships and ideas to make sure that we have pathways to success for all the residents of our community. And hopefully spread the word to folks who probably tune in episodically, that this is hard work, it's complicated work. We have days where we can celebrate success, but we have lots of days where we feel challenged by the need. But we have so many people who really want to do the right thing. That doesn't always make the paper, but a lot of people want to do the right thing, and there are lots of successful stories. And so that has been the opportunity that I think we have realized. And here we're at the cusp of maybe a lot more resources coming to our community. So I'm glad we're thinking about how to integrate our services for the best impact, collective impact.
Thank you, Reggie. Jim or Monica?
I guess I'll go. And yeah, I mean, when I reflect on the last year or so, I guess I'm just so inspired by what happened. You know, like many people, this last year was one of the most challenging of my career. And early on, we just needed to figure out how to keep our offices open and continue to serve the public. I think we can all remember how anxious everybody felt at that time. And it was just, you know, it was so difficult. We did everything we could to figure out how to protect our staff and the community. We scrambled to be able to do COVID testing with quick results. And as Reggie was talking about, we do collaborate together. And in talking with Henrico County, we learned that they had a contract with BetterMed to provide COVID testing. And so we kind of piggybacked on that arrangement, so to speak, so that we could get quick turnaround results for our employees to be able to continue to serve in those essential positions.
Okay. Monica, why don't we, as Jim's coming back, why don't we turn it over to you? If you don't mind starting, we'd appreciate that. So thank you.
Sure. There are benefits to going last. I think as my colleagues were talking, I had words that came to mind as I thought about what it was like to be a leader in 2020. And I jotted down, it was incredible. It was exhilarating. It was scary, overwhelming, but I was extremely honored to be a part of leadership in Henrico and in a part of this region during the pandemic. The word I've used, and my colleagues have said they're going to get me a t-shirt printed, is unapologetically rogue. I feel like that is how we, as a community, as leaders, as a region, we unapologetically rogue. What we did here in Henrico, as Jim mentioned, standing up the first testing site, as James and Reggie can attest, and Jim, as we were having our regional collaboration meetings, our peer group meetings monthly. I mean, literally coming on and just saying, we have policy, procedure, we're putting people over policy at this point. Not to the point where, we threw legal things out the window. Of course, we stayed to the law, but when it comes to bureaucracy and allowing things to prohibit us from serving the communities the way that they needed to be served in those moments, we did not allow that to happen at all. As a community, I feel like, we band together. Of course, we'll get into more of this, our regional cooperation and collaboration and how we worked. But when I think about our cross-functional, even across agencies here in the county and how we all work together, I mean, it was just, it was a no-brainer that we were going to do whatever it took. Before Jim fell off, dropped out, or before we had the technical difficulty, you heard him saying starting a daycare. I had to chuckle because I didn't think I would ever be in the daycare business either. I did work for Smart Beginnings, so I had some early childhood knowledge, but understanding, the establishment of, informal childcare centers during virtual learning for Henrico was imperative. It was a no-brainer. It wasn't just for our employees. We wanted our community to know that, with the CARES dollars, that we were committed to supporting the childcare providers or the after-school providers who turned into full-day providers in response to the virtual, standing up informal and formal food pantries, supporting the formal food pantries that were already established, and literally establishing food pantries. I didn't think I would go into the food service business either, but if you tell me that you need, we're feeding X number of families over X number of point of time, I know how much to order, how much to get through, how many volunteers I need for packing and for distribution. So garnering new skill sets was also a part of being a leader in 2020. But yeah, it came with its challenges. We had days where it was exhausting and a continuous reactionary, coming in every day being reactionary to what was happening in our community. To know that Henrico in those early days, with the Canterbury living situation, being second in the nation for COVID deaths, and it happening just in warp speed, and getting ahead of that unapologetically. I mean, these are things that we did. We had, no right, no business, but we made it our business to get involved with those private entities, to be able to help and assist in any way we could. Obviously, like you heard from my colleagues, obviously establishing equity, diversity, and inclusion offices here in the county with employees now who are specifically focused on making sure that is a priority, not just a program, but that is the fiber of who we are as a locality, as a county, and how we serve our residents and our communities. So, you know, when talking about the civil unrest and all of that, being up all night and a part of the in the EOC and with the emergency operation team and our public safety folks, it was constant, it was ongoing, but it was one of the most rewarding things I could have ever been a part of. And I say that COVID is definitely not in our rearview mirror, but I definitely feel like it's not riding our dashboard right now. And it's really refreshing to be able to strategically plan and strategically think ahead, and doing that with these colleagues and honestly partners, community partners like the Community Foundation. Well, those lessons learned that we learned last year or over the last 18 months will definitely give us that leverage as we start to move ahead with COVID with us, and what that looks like as a region, as a locality, as a community.
Monica, thank you. Jim, I know you were interrupted and we're so sorry about that. I'm going to throw it back to you to finish your thoughts before we move on to the next question.
Yeah, that's okay. And, you know, I guess if anything, we've learned to adapt and be flexible. And so that's just the way that it goes. I guess I would just maybe make a couple more points. And that is that we were creative in partnering with United Way. I don't know if anybody from United Way is on this call today. I suspect probably, but the other James Taylor over there and Audrey and all their team, we partnered with them to provide some CARES Act money to our community partners to be able to help with housing and food assistance and utilities. And so, you know, we were lucky. I guess, you know, one thing that I've learned is to take advantage of the partnerships that we have in our community. We have so many great agencies already here, and they're the experts that are doing a lot of that stuff. And so, you know, just so thankful for them. United Way did not charge us one penny for any administrative expenses. All the dollars that we had to work with went directly to the agencies. And so just one example, I think, of the great work that happened. So, and then I'm sure at some point we'll talk about vaccine and everything that was involved with that. But wow, that's just, it's just amazing to think about what happened in the last 6 months, how busy all of us were. And hopefully we'll have a chance to talk a little bit, maybe more about that as we proceed. Thank you.
Thank you all. So we're gonna stay focused on the last 18 months. So if you can, talk to us about what was the most difficult decision you had to make during this past 18 months, and how did that relate to priorities within your jurisdictions?
Am I back up again? I don't mind jumping in. Reggie, did you get a chance to speak on the last issue? Yes. I'm gonna jump ahead of you. Okay. So I'll be happy to speak on the most difficult decisions in the last 18 months. And you know, Amy, I know that all of the pandemic is considered difficult, but I really see these as more important action steps that we had to take over the last 18 months in order to get us to the point where we are today. So related to the priorities for Chesterfield, one of the things that was crucial for us, and it was a pivotal turning point when we had the opportunity to develop a MOU with Chesterfield Health District. And of course, the Health District consists of Chesterfield County, Powhatan, and the city of Colonial Heights. What that MOU basically allowed Chesterfield County to do is to have oversight of vaccine operations once we're able to roll those out. Also allow access to the data. I would say the raw data that was kind of the dirty data, if you will, had to be cleaned to improve data management, and the registration system for vaccination rollout also. And having this MOU in place provided us to see what additional staff was going to be needed and volunteers needed in order to support the vaccination rollout to the workforce, schools, and the community overall. We had the opportunity to stand up community vaccination sites around the county, and of course, in collaboration and partnership with our friends that are on the call today. And I won't steal their thunder because I know they're going to talk about this as well. And then one of, I think, the key action items that we were able to have was to partner with Virginia State University to use mobile health units for community vaccination outreach efforts, particularly at the Rockwood Park and the Fallen Creek Apartments off the Jeff Davis corridor in Chesterfield. And then develop a vaccination database for tracking purposes was a big undertaking with folks in our IT department and some of the folks that are really good statisticians here in the county. Was able to place a quarter on our website for the public to have interface and be able to have, I'll say, real-time data within a day or so of information that uploaded from VDH. And then another key piece of the whole important action steps is that communication piece outside of the website. And I must give a huge shout out to communication and media because without them, things like Facebook Live events, community conversation meetings over Microsoft Teams or other venues like Zoom, and certainly text message alert that we use for COVID updates would not have taken place without the dynamic communication and media team and all the things that they've done as well. So those are just a few things that come to mind in terms of important action steps and certainly difficult decisions that went along with some of those things as well. So I'll pause and share the time with others.
Thanks, James.
Reggie here. You know, I have to say that personnel matters were difficult because this was a case of first impression for all of us with regard to standing up and moving forward and doing your job in the midst of a pandemic. And the nature of our work required us to give it 110%. And to be quite frank, you know, I think there were people that might not have been cut out for this kind of human services work. And so smart people who prior to the pandemic might have been okay, might have been good, but we have to move into a posture now of folks who are going to be great at their jobs. And so it was difficult in this role, as all my colleagues know, to have to, you know, maybe move someone outside of, you know, separate them from working with you, people that you might like, but this is just not the best fit for them right now, you know, at this point in history and with the work that we have to do. So I will say, you know, I'm a human being and those decisions are hard but necessary. So that was difficult. So that's what comes to mind immediately. In the midst of all the other challenges and decisions we had to make during the course of the day, you know, having to make those kinds of those conversations with people is always hard.
Thanks, Reggie.
Along the same lines as what James spoke about with Chesterfield establishing theirs, for those of you who don't know, Chesterfield has its health district, Richmond and Henrico. So Reggie and I share a health district, and our health leader is Dr. Danny Abula, who we know went up to be the czar for the governor for all things COVID vaccine. So even with that, it posed some challenges as his deputy taking reign and Popovic, who many of us saw on TV day in and day out, being the face of, who quickly became the face of COVID vaccinations. So so I will say, Amy, for me and us, our jurisdiction, to be first is always very difficult. And anytime you are a leader amongst your peers or a leader in the region, it's a risk like establishing our own, of course, in partnership with the health district, but establishing our own vaccination clinic. It was a huge risk, and it was very difficult at those tables as we were talking through and things moving at warp speed. Not just, again, back to the unapologetically rogue, not just, you know, thinking about policy procedure and what it would mean for us as a locality if we didn't succeed. That was not even a question at those tables and in those conversations early on as we were deciding that we were going to stand up our own. No ifs, ands, or buts about it. As we were telling the health district, we were going to stand up our own. So, you know, it became one of those things that became all consuming. And you don't always get it right. Early out, we had a link that got out to more people than what we had vaccine. And literally at 4/11, those of you who know me, I became the gatekeeper at the Richmond Raceway Complex. So literally standing at the gate and turning people away who claimed that they had an appointment, and they did have an appointment, but those appointments got canceled because the link got out. You know, so those eras, again, to be first and to be out in front and to be innovative and bold, it comes with a cost sometimes. And I just remember those days being the most difficult days, and especially early out with the vaccine, early January, when people were so desperate to get it. You had people who were just clamoring. I mean, humanity was not, there was no empathy and there was no humanity in the eyes of some of the folks that the bouncer had to turn away at the gate of Richmond Raceway. But we got through it like everything else. And then as James and Chesterfield and Jim and Hanover started to come online with their partnerships with VDH, we had some pitfalls that we could share with them of what not to do. So, and then in those early days to be able to partner with each of the localities, including Goochland and New Kent and Charles City, and to be able to help them with their vaccination of their teachers, who were the most important, obviously, and their public safety folks. And all of that, it just showed that it was all worth it for us to take that risk, to be out in front, to be unapologetically rogue in what we were going to do. We weren't going to allow policies, procedures, bureaucracy to keep us from doing what we needed to do to serve the community.
Thanks, Monica. Jim?
Yeah, I'll just say, I think one of the most difficult decisions at the time, thinking back to March, was pulling back that merit increase for our employees that was scheduled for that July. And I believe that all 4 localities did that. We had to, we just didn't know at the time. You know, we were anxious about revenues, and you know, it was just one of those things. And you know, of course, the employees were so deserving through it all. But that was really difficult at the time. Of course, something that wasn't in my mind so difficult, but that needed to be done was just step up and support our health department, as has been mentioned. And I think a lot of people think about government as being this big ship, you know, out on the sea, and it's difficult to turn it, you know, once it gets going. But we had to do that. We had to stop and rethink things. We asked our internal audit department to stop what they were doing, you know, put audits on hold and become a call center for our residents, because that's what the health department said they needed. And then to redeploy staff to those efforts. And so, you know, while it may have been difficult, it was just the right thing to do. And you know, we also had to figure out how to conduct business, including our board meetings. We continued to do those in person, which was difficult because it was always changing. And, you know, sometimes it was 25 people that could be allowed in the room. Sometimes it was 10. We had difficult, controversial cases going on, you know, during that time. And it was not fun, but, you know, we did what we needed to do in order to get through it.
Thank you all for that.
Hi, Amy. It's Scott. We've got a question from a participant.
Sure.
Health has been mentioned a few times, and this attendee asked, how are our regional leaders coping with the current mental health crisis? How are local critical care needs being met?
Who would like to start?
I don't mind starting. I'll just start out by giving a shout out to Kelly Freed, our mental health support services director with the Community Services Board. We're excited to have such leadership in that part of our organization. And you know, when you asked the question, how are we dealing with mental health crisis? You know, that's one of the locations that never stop working. When you talk about residential services, our folks working 24/7. Have been there in spite of COVID, you know, moving into telehealth opportunities to meet clients where they are. So again, those folks never stop. So they have been dealing with mental health crisis all along. And so, they're also dealing with other issues when it comes to substance abuse. They're in the midst of working out logistics very soon with items that consist of Marcus alert and those type of things too. So they have their plate very full, and are continuing to manage those items in a professional manner, and that makes us very proud that we have these such leaders in place here at Chesterfield to be able to do that. So I'm not sure if the person that asked the question is asking specifically to mental health of the community, or how our employees doing since this time dealing with mental health, because that's a different, probably maybe a different answer when you start talking about the mental health of employees. Of course, EAP programs are available in-house, and certainly encourage our employees, because we recognize that everybody's circumstances have certainly been different when it comes to the mental health of the employee. We've had employees themselves that have contracted COVID. We've had employees that may have lost a child, a parent, even myself, a grandparent. I've lost a grandparent. We know people along the way, so we have to check in with our people, and that is part of leadership within our organization, to make sure that your people are okay, and if they're not, seek help for them.
I agree with everything James just said. In Richmond, of course, we work with the Richmond Behavioral Health Authority, and I mentioned John Lindstrom earlier. His team has done tremendous work. It's been challenging for all of us, and obviously, no doubt we need to work together to expand our mental health services opportunities throughout not only Richmond, but throughout the region. One of the things that became really clear, we have ambassadors in Richmond who literally were going door to door in certain neighborhoods, particularly neighborhoods that public housing communities. And they were trying to make sure that parents had their kids logged on for virtual learning. But in that process, what came back to us was what they learned about the prevalence of mental health challenges, the stress, the anxiety. Of course, there's already anxiety when you don't have enough money to have your basic needs met. But layer on top of that, a pandemic, and then worrying about your children and your job, and maybe not having the same number of hours because of the pandemic. So it became clear that we need to, work with all of our community partners to focus on the unique and stressful situations that occur when you don't have money as a buffer, or a lot of money as a buffer. And sometimes that leads to tensions that can cause trauma, even more trauma for children and neighborhoods. So all of that became, of course, we're advocates for anything that we can do to support Richmond Behavioral Health Authority, and at the local and state level, national level. I think it's becoming front page news because it's clear. And maybe people who have been able to manage life without having to face those difficulties, unfortunately like James said, because of death in their own families or seeing the impact of this pandemic, realize how easy it is, unfortunately, for you to have depression and other anxieties that relate to this kind of crisis.
I'm becoming very conscious of time, and just Monica or Jim, do you have anything else you'd like to add to the question right now?
My only add was just going to be to piggyback off of what Reggie was saying, and with our work, obviously working with HCPS, Henrico County Public Schools as well, because we know for adults, the mental health and anxiety has been one thing, but not negating or not paying attention to and responding to the needs of our children is currently, not just what we've been doing over the last 18 months, but currently a major priority for us.
Thank you, Monica.
Yeah, and I guess I'll just say, and I need to acknowledge Ivy Sager from our CSD too, and the great work that her folks have been doing. And it is a real issue, and I am concerned about the students, particularly the students who were working virtually, and now are going to be transitioning hopefully back in person and just kind of readjusting to life that way. I will say though that I think that mental health is being discussed now more than ever, and we even see it in the Olympics, right? And so, that's a positive thing. We, we do have several initiatives, I think, ahead of us. Of course, we're trying to figure out the new Marcus Alert law, which, is being piloted around the state. And then, of course, speaking of substance use, we've got this new marijuana thing out there, which we're all trying to figure out. And one thing is certain that I think we've realized is opioids did not go away during the pandemic. That's a real issue. I think if anything, it's gotten worse. And so that's something now that I think was on the back burner during the pandemic that we need to get back off the back burner and focus on how we can help our residents with that issue.
Thank you all, and thank you for the question. I'm going to shift gears a little bit, and we're seeing some of this in action today, but the question is, talk to us about how you collaborate with other localities, especially amongst yourselves. Like what does that look like? What are some of the success stories and what are some of the obstacles?
Well, I was definitely cheering on Monica in particular, James and Jim. All of us had to jump in new ways with the vaccine and notifying people about the vaccine. And we played a role in trying to man a call center, to do our role as well. So I felt like that in particular has been a real clear evidence that once we know we need help, we can pick up the phone and call each other and figure out ways to make it work. So that's just one thing that comes to mind. And Jim mentioned we were already working on a regional approach to the opioid crisis. So that's been going on for quite some time.
I'll just very quick piggyback on you, Reggie. I mean, I find it beneficial when I have the opportunity to meet with Reggie, Monica, and Jim to share ideas, ask questions, and discuss regional issues. The group has a good synergy, and it's certainly a good brain trust and a safe zone for sharing information that we have the opportunity to share with one another. And the pandemic is a major collaboration, and it's probably the most visible collaboration I think that people can see in the community, all the things we've had to do. And then this, just an idea for one other collaboration that we have been working on is the concept of regional homeless shelter as well. So the three localities certainly are working on that initiative. But I'll pause and let others, since we are certainly a long time.
I'll just say, some wise person said that the best time to make a friend, something along these lines, the best friend to make a friend or build a relationship is before you need one. And so I think that proved to be true during this last year. We do work well together. Probably most people on this call understand that. I'm not sure that the average resident in the Richmond region knows how well we all get along and work together. We do rely on each other for best practices and for sharing ideas. The four of us talk regularly, about once a month, and recently we've been able to get together for lunch again, which has just been terrific.
Definitely ditto what I said about how we work well together, but I mean, beyond that, with the projects I brought up to these guys yesterday, just remembering our regional IMT in the early days of COVID, and being at the table and bringing in our DSS and our emergency management teams, our public safety folks, and to watch that it was an engine operating out of the convention center and setting up command posts and having points of communication in each of our agencies who were, as we've said many a time, just essential workers to the response of the needs of our residents and communities, and it has just grown from there. Many of these things were in place prior to the COVID pandemic and the COVID response being a need for us to come together, but we have really shown and proven that we are stronger together, and I think that the folks on this call, our community partners, can attest to and will continue to see that stronger together mentality from each of our localities.
I thought of one more thing that people might not realize is that our employees sometimes move between our different jurisdictions. So you know, someone from Richmond DSS might get a job in Hanover or Chesterfield or Henrico or vice versa. And I think that's a strength, because hopefully whatever jurisdiction where they learn the craft, that helps them to do the best job they can when they go to the next jurisdiction. And so we're all learning from each other. And we don't call it poaching. We just, we really appreciate that we have some talented people who work for human services in the region.
That's a good point, you know, Reggie. Leaders breed leaders, and you know, our directors that work with us, our business partners, mimic what they see us do, and if we are working collaboratively together, they're going to work collaboratively together across the river and across the highways. You know, I know Chief Rogers, our DSS Department of Social Service Director, worked very well with Ty over in Henrico, and of course there are other examples that we can share as well. But that's just one example to show when upper leadership work well together, it's a trickle-down effect where others will also begin to make those connections and have those bridges, which is so helpful for the entire Richmond region.
Thank you all. Thank you.
Amy, can I make one more point? I'd
Sure.
like to recognize Henrico County for this whenever I can, but I think Monica touched on this, but in January, you know, kind of at the beginning of the vaccine process, Henrico was able to get their hands on some vaccine. I'm not sure how they did it, but they had it. And they could have held that for themselves and taken care of their—
She went rogue.
Yeah, she went rogue. Of course, she's been saying that. All right.
But they didn't. They made that available to the region, and we were able to get many of our school teachers in there. And most people probably know that Hanover schools were in person the entire year. And so that's just tremendous. I think collaboration and regional work. I know a bunch of our seniors were able to go down to the raceway and get their shots early on. So I just, again, want to thank Henrico for their leadership on that initiative.
That's wonderful. Thank you all. So earlier we had the opportunity to see a slideshow related to the Community Foundation's priorities. So we looked at early childhood development and education, workforce development, and affordable housing. So when you think about the word thriving, where do you devote most of your energy to lift people out of poverty and on a path toward economic mobility?
For us, it's, you know, community wealth building is the framework that we use in the human services portfolio. And it's critical for people to have more resources so they can make their own choices about life, whether that's education, health, transportation. We are at a point, and I'm gonna get on a little bit of a soapbox, not too much. You know, most of us have been doing this for years and years and years, and we have got to think about the end game. And the end game is to reduce the poverty rate. You know, we want to get closer to Hanover. You know, it's just, but there are variables that we need to think about. Where do people work? Where are the jobs of the future that pay a living wage? Where do people live? We have an affordable housing issue. I mean, like, here's an example. We've had a successful case with a guy that had been in prison for years, came out, found his way to the Office of Community Wealth Building, went through job training. We paid for him to get his CDL. He did well in that training, purchased a tractor trailer, saved money, and then he and his family were able to build a house in Henrico. You know, so this is someone who, you know, if you look at the statistics, he shouldn't have become so successful. But I think the point is, when we all work together, you know, we can open pathways to success. We need that to happen by the tens, by the hundreds, by the thousands, so that we can, as a region, make ourselves more attractive for corporations and other businesses to come here. So to me, the key issue is the nexus between health and wealth, making sure we have a good quality of life, but we have people who are making enough money so they can thrive. And it's regional.
Thank you.
I totally agree with Reggie. It's interesting you use the term thriving. That actually, Chesterfield has a strategic plan, and thriving community is one of the 6 goals in our blueprint. And so we look at the goal and say, what is this thriving all about? We look at it and we say, quite honestly, it's the ability to be able to enrich quality of life, enhance community attractiveness, and preserve natural resources. And, through a myriad of ways, by fostering long-lasting communities with unique identities within the community, enhance and restore. So maintaining neighborhoods, as Reggie talked about earlier as well, and communities using public and private efforts, which is always great when you can bring public and private efforts together for partnerships. Continuous improvement in public infrastructure and facilities is part of the whole thriving concept. Being responsibly to the environment, and that's also important when you consider a thriving community. And then one of my favorite parts of when I think about thriving is partnering with nonprofits that are working on similar thriving goals. And I know that we have several that are on this call today. So thank you so much for working with us. And one of the things that I really think that is great, and I know that the localities that are represented here today, Reggie has it, Monica as well, and I know Jim works in this industry too, with looking at collaborative networks. But Chesterfield had the opportunity to found Chesterfield Nonprofit Community Collaborative Network back in December 2020 during the pandemic, which really focuses on bringing the nonprofits together to really talk about thriving goals and things that we have in common, how can we work collaboratively across the Greater Richmond region to attack and some of the major issues that are going on in our community. And so I'm just really thrilled about this.
I guess I would say, as I mentioned earlier, affordable housing is a work on for Hanover, is something that we need to continue to work on. I would say the main thing that we try to do is invest in early childhood development here and do some preventative work. Amy and I got to know each other because of Family Lifeline and bringing home visiting to Hanover. And so I think that's helped a number of kids get ready for school and for life. We've got a great Hanover Early Childhood Council here that does some good stuff, including, folks may not have heard about this, but the Dolly Parton Imagination Library, where we have a number of kids who get a book in the mail every so often. I don't know if it's once a week or once a month, but little things like that, I think, make a difference. And so I think that's the most important thing that we can do, is invest in our future.
Thanks, Jim. Monica?
Yeah, I mean, ditto what was already said. I mean, those social determinants of health is so important, and the work with our community partners who are doing this work. But I think the one thing that may not have been said, but I think it's imperative for each of us, is how we serve our resident when they come in. If they're coming and entering into, Reggie and I have been talking about this for years, the complex system, and we have someone who's coming in for services, whether that be mental health, DSS services, or wherever they enter into this complex system workforce, that it is a one-stop, that we are able to provide those services for them throughout the system as they navigate to get the services and the supports that they need so that they can get to thriving. I can't be resilient and be self-sufficient if I don't have those supports, and those wraparound supports and wrapping around our residents to be able to help them as they navigate and get to thriving, to be that example that Reggie just gave us of that resident who started his own business, who saved and now is a homeowner. We want that to be the story of all of our residents. I used to say when I was working with the city, we want to put the Office of Community Wealth Building out of business. That is the goal, so to get people to thriving, we have to support them in a way that they are able and have the tools and remove those barriers that prevent them from getting to thriving.
Monica, Monica's right. We've talked about this for years. We have to move into a mindset of services and systems integration. Mm-hmm. And it's going to, we all know it's going to be difficult, because that require us to share our information about children, maybe their parents, their households. We need a bunch of lawyers and IT people, to help us figure out, because it's happened in other places in the U.S. How are we able to, let's peer into a database, so we'll know if this family is being served by someone in Hanover or Chesterfield and Henrico or another nonprofit in Richmond. Because if we're disconnected, it might cause those families to spiral and stall, and they might have to rely on the breadth of knowledge of their individual case worker. But we need a way for people to know everything that's available to them from a local perspective, state perspective, and we have experts out there, but let's use technology to make sure we can lift people up together at a faster pace.
Great, thank you. I think it's really important. I know I've said this before, but time is going by so quickly. So I do want to ask this question. We know that regional demographics and needs are changing, and that has to impact your work. I know it does for all of us in the community. So let's talk for a few minutes about how you're serving various populations. And I want to start with people who are immigrants and refugees. So if you could speak to how you're serving or where you believe needs are, that would be terrific.
Been on this one. So we also have, in addition to our internal equity, diversity and outreach, and inclusion coordinator, we also have a community outreach coordinator. And Raina's job is to think about how we communicate with our language, provide language services to our diverse communities. And thinking about that, I know that we have a growing population of all of our immigrant communities, but particularly with the Hispanic community and Latinx community. And we've just made a commitment to that communication. The very first COVID response piece that we put out, wear a mask, keep distance, stay at home, was in 11 different languages. That's unprecedented. Working with our schools to ensure that their Office of Equity, Diversity and Outreach, we're in alignment in those communications that we're putting out, and we're streamlining and working together, because we know that a lot of times our students are the ones who are translating for families, for parents and grandparents, to understand where those testing resources were or how to get the COVID vaccine. And so thinking about the work of Raina's office and what's coming out of our PR and communications, beyond that, our community partners. Again, we could not say knock, knock in communities, this is the government calling, we want you to come get a vaccine. We had to go through existing partners. We had to go through those trusted partners in the community to serve our immigrant and refugee communities. A lot of that was through faith-based pilots and initiatives that, again, unapologetically rogue. We were the first to say we were not going to check IDs. So we would figure out a way to navigate the state system to get people vaccinated who wanted to be vaccinated. But we, again, couldn't say, we promise it's safe. There won't be any officials there checking IDs. We had to have those trusted partners within the community to get that message out for us, and to be able to speak the varying languages. And I will say the city of Richmond, Carla Ramirez and that team, working with Sacred Heart, working with Reestablished Richmond, for Richmond Network with faith partners, the Henrico Ministers Conference, I could go on and on, but the intentional work, very strategic, very intentional, methodical was the word that our county manager used quite a bit over the last 18 months as to how we targeted and communicated with our immigrant and refugee communities, and to ensure that they knew that the resources that we were providing were for everyone, that it was not about any kind of documentation status. It was about getting services to where they needed to be. And we continue that as we continue to work with the Virginia Department of Health to get the information out. Radio Poder, we are on the radio. We've done ad buys with our Hispanic radio stations, because we know that that is the way to meet that community with the language services that they need. Having language speakers within our human services organizations and agencies is imperative for serving the community. And meeting them where they are, so just having intentional strategies as to how we're serving our immigrant community just, it's imperative, and we, obviously there's still opportunity, but we continue to thrive, strive to meeting those needs and growing our diverse population internally, our employees, so that they can be able to mimic and represent the communities that we serve.
Thank you.
I'll just jump right in too, if I can, and kind of piggyback on much of what Monica said without trying not to duplicate. But Chesterfield, we had the opportunity in 2020 to really reconsider how and what we look like in terms of providing services. So we had the opportunity to take a position and reorganize a position and create a position for diversity and inclusion. And Kim Connolly, who I mentioned earlier, took on that role and really developed much of what we are talking about today. And later, just a few months ago, we had the pleasure of bringing aboard Delilah Mandrano, who is our multicultural services coordinator as well. And I know that they're probably hanging out on the call today as well. So I'm going to put a spark plug in, because I'll get in trouble if I don't, for our SPICE Festival. And SPICE stands for Sharing Practices of International Cultures Through Engagement, and which is really significant to this discussion as well. So Delilah, Kim, if you guys on, if you go ahead and put that link in the chat box for our other friends to be able to take a look at, that would be great. Give them the details of how they can get more information. But the event is going to be Friday, August 13th and Saturday, August the 14th at the Perkinson Center here in Chester. Where live music, gallery shows, and cultural performances, guest speakers, and et cetera. Food trucks for international cuisine will be made available as well. But to get a little bit deeper in terms of the community, it's been a great opportunity for us during this pandemic to partner heavily with the Chesterfield Health Department here, because we had the opportunity to do more outreach, particularly in our minority communities, not just Latinx, but also particularly in the African American community, where both of those populations are very skeptical about taking the vaccines. And so dispelling some of those rumors and myths and putting education in the hands of folks has made all the difference to kind of get us to a point where we have more people vaccinated now. And so having those outreach units, and then of course working with the health department to take an old Big Lot store off of Courthouse Road and Whole Street Road intersections to be able to have a community vaccination site where we can also continue that effort, not just for the vaccine for COVID, but also for vaccines that school-age children will need in order to go back to school this school year as well. And so, and part of that, as part of our county structure too, we also have a diversity advisory committee with the county. And so, we work very closely with our HR department, as well as our learning and performance department as well when it comes to training, because people don't know what they don't know. Culture competency goes a long way, but you got to train for inclusion. You have to train for culture competency, and so that's what we focus on in the county, to make sure that our staff is equipped with the tools they need to be able to interface with the public. So I'll pause there and give you a chance to say something.
I think this is all right on target. Carla Ramos in our Office of Immigrant and Refugee Engagement has done a tremendous job. And she challenges us to make sure that we are living up to our ideal of one Richmond. And I would say, obviously one region when it comes to every voice matters, every person's voice matters. And that means we need to understand the language, or at least have a way to have it interpreted or translation services, so that no one feels that there's a barrier that prevents them from finding the help that they need. And as my colleagues have mentioned, sometimes that help doesn't look like an official government office. That's when we use our partners who are embedded in the community. We can feed them the information and the data, just so a trusted entity is able to provide the help. And internally, just like my colleagues mentioned, we're trying to make sure that our staff fine-tunes its ability to be bilingual. We need to definitely expand the number of staff that are bilingual or trilingual. And we also have cultural brokers that have been coached by the Office of Immigrant and Refugee Engagement, meaning if if there's something that occurs in a department and you don't have anyone in that department that has that cultural sensitivity, then we have folks on staff who will be in partnership with that department to help translate or to navigate it so that we have a positive experience both for the person looking for help as well as for the staff person. So I feel like all of us in this region are really understanding that Richmond is not just black and white, you know, literally and figuratively. We have to be nuanced in our approaches and open to all kinds of voices and perspectives.
Thanks, Reggie. Jim?
Yeah, well said by everybody. I'll just say that we need to continue to be able to communicate and serve all of our residents and visitors. And we're fortunate to have many employees who are bilingual, and so that helps. But we also have access to a language line and translation services, you know, when needed. I'm not sure if people realize this, but if you go on our websites, down at the bottom under, I think it's Site Tools, you can click a button and translate that page to Spanish. I'll give the city of Richmond kudos because I went on theirs and you can translate it to like 100 different languages or something. So we'll be talking, Reggie, about how you work that magic. But as Reggie said, I think the most important thing is to rely on our community champions. I'll call them champions because I think they're the folks out there in the community who are really doing, you know, some great work for our residents who may not, you know, English might not be their first language.
Thank you all. So one of the things I want to acknowledge before opening it up to additional audience questions, we had a question that I was going to ask the panelists about how we as a community can get involved, and we will make sure that all the participants have a link to your different sites so they can link with you and look at further involvement. So Scott, I'm gonna turn it to you for a second. Are there other audience questions?
Yes, there are. There's a theme in questions about regional transportation. I know that's been mentioned, but if any of you'd like to elaborate on that, it would be welcomed. Thanks.
Well, I'll begin with, you know, I mentioned earlier, we have the Human Services Expert Cabinet that meets every other Wednesday. And when we pull that group together, you know, like I mentioned, it was a backbone organizations for basic human needs and other psychological supports, including how we have a more compassionate community. Transportation, clearly an issue. Our good friend Damon Jiggett raised his hand to say that he would begin to pull together a way for us to, you know, sort of coalesce around what's the current capacity for transportation in this community. I'm not speaking about nonprofits and children and families moving around. And that's Red Wagon is the entity that he created. Of course, we are extremely supportive of an expansion of you know, the Pulse or GRTC, and just ways to keep that free as a way to make sure that getting to a location is not a barrier. Let's face it, Richmond is not like DC or New York. You do need to have public transportation to get places. So this is an opportunity for us to be really creative in the community. Maybe that's something that can rise up in addition to the idea that Damon created with Red Wagon, so that we can have a more regional aspect to getting people around, working with companies or businesses. All that should be expanded, in my opinion.
Some exciting things are happening around transportation, and it really isn't under my umbrella, but as you may know, the General Assembly established the Central Virginia Transportation Authority. And so that's millions of dollars coming back to our region to help with transportation initiatives. I know a percentage of those dollars goes to the GRTC to develop a plan for more, I'll say, public transit. So I think some really neat things are happening. And so I think just, you know, stay tuned for more of that. In Hanover, we have a new specialized transportation program for our seniors, those age 60 and older, or people with a disability. So the state provided some grant money to us in order to get that going. So I think some neat things are happening, and so excited about the future.
And I'll just add, not all transportation is on four wheels or buses and cars. Transportation also consists of people having access to bike and walk to a location. So I think the region is really excited about the Fall Line trail that will touch our localities as it comes from Ashland to Petersburg. And so I certainly encourage everyone that's involved to kind of pay attention and maybe do a little research on what that consists of, and as it continues to be master planned out in the future.
Yeah, kind of like a Capitol Trail bike lane,
Right.
But from Ashland to Petersburg.
Absolutely, that is also a economic engine for jobs and connectivity from jobs to home, from home to jobs to restaurants and parks, and of course health and wellness plays a role in that as well. So having that additional connectivity brings in money, quite honestly, to the entire region from people that are also visiting and wanting to do things outside of the hustle and bustle of what a train or a car or a bus might provide.
And I was going to plug this later, but everyone should always visit Help One RVA, Help the numeral one RVA. Look at putting your zip code and then transportation and see what kind of resources are there. And if there's something that's missing, I'm sure the folks at the Y, I know the folks at the Y would want to have that included, because that alignment, I think Monica mentioned earlier, that is a challenge. We have an abundance of resources, and sometimes people say, well, no one knows about us. Well, we have to pool that information together so we can take full advantage of the work that's being done.
Thank you for the answers to that question. I'm going to ask one last question, and my apologies go to our audience. We have not been able to get to every question, but thank you for raising them. The last question, and this is going to challenge all of you, I want you in one sentence to answer the following question. And that question is, whether it has been announced or not, what is your most significant accomplishment in the past year? One sentence, and I'm going to Monica first.
Okay, one sentence. Vaccinations targeted towards vulnerable population groups.
Excellent, thank you. Reggie.
Thank you. Being a pilot for guaranteed basic income with the Richmond Resilience Initiative.
Let's go to Jim from Hanover.
I would just say early on with the pandemic, continuing to help the people who needed it. And then more recently with the vaccination center, being able to provide 60,000 doses to our residents. Just incredible.
And we'll end with our friend James.
And as my kids would say, would you repeat the question, please, about it more time? No, I'm just kidding. I remember the question, but that's one of the ways they like to stall at home. Well, that's very tough in one sentence. Wow. I'll just say very quickly at this point, having almost 92 or 92% of our vaccination goal for our community, when I say our community, Chesterfield specifically, is a win. And the more people that we're able to vaccinate, keep alive, and deter the different variants is a win for us in Chesterfield and the region.
Thank you all for those responses. I'm going to close now with one last slide. If Scott could bring that up. As that's coming up, I want to thank Amy for her expert facilitation skills. I texted her during this session and said, I love her style. I think we'll have her back and she can become the moderator for many of these to come. And lastly, I want to thank our panelists. Certainly there is a sense and spirit of collaboration among the four of you. Personally, it gives me great hope to listen to you and realize that significant issues are being discussed and that people are at the center of your work. So heartfelt thanks to all of you. The last thing I'll mention is that following this, we will send the participants an email with several of the links and opportunities for volunteering or attending events that have been mentioned. So watch your mailbox. And then lastly, I apologize for the technical glitch, but welcome to 2020, 2021. I think it shows our resiliency and our ability to adapt. So with that, I want to thank all of you who have attended very much. Watch our emails and our website for additional events. And it's really been our pleasure to bring this group to your screen. So have a good evening and we will see you soon. Thank you.